I'd like to thank everybody for attending the webinar tonight, the Medical Marijuana Awareness Webinar. Tonight's subject will be fibromyalgia, and we have a kind of a special guest, Dr. Michelle Weiner, who's going to join us. We are privileged to have her here. We really appreciate having her join us. And as with all of our webinars, we have just a few housekeeping things. First of all, you'll see over here a little button that says Q&A, and please feel free to ask questions. Obviously, at any time, we'd like to have your questions. The objective of this webinar is not only to answer your questions, but to give you some information about some qualified, some vetted information about fibromyalgia. So please feel free to do that. That's what we're here for. We do see there is a chat, but we'll mainly use that mainly for background information. We're going to pay attention more to the Q&A. The other is that this is a webinar that is serious for a lot of people. So please understand that this is medical marijuana. It's not recreational marijuana. And what we like to do is make sure we address the medical side of things right now. So without further ado, I'd like to get going and introduce really a special guest that we've had the privilege of having on here. Dr. Michelle Weiner, you've been practicing for a while. So tell us a little bit about yourself and tell us a little bit about what you plan to do.
Sure. So I'm a interventional pain management physician, and I've been practicing cannabis medicine for about 4.5 years now. I'm kind of review a little bit of some of the research I've done personally, and I really am a huge advocate. I work with the Department of Agriculture through the committee that we have to make sure that everything's going smooth in Florida. And I've really become more of an integrative pain management physician, using more holistic options for pain, not just physical pain, but emotional as well. So fibromyalgia is a topic that I'm very familiar with. I studied it when I was a resident at University of Miami, and now I have a lot of the University of Miami attendings that actually send me their patients because cannabis seems to be a more effective treatment for that than most of our pharmaceuticals. So I'm looking forward to sharing some of this information with you guys.
Fantastic. Well, you have a presentation to go over, and so why don't we dive into that? I'll let you share. Let's see. You can share the screen, right?
Yep.
Why don't you do that, and I'll let you take over.
Okay. All right. Does that look good? Everybody can see?
Looks good from my standpoint.
Okay. Perfect. All right. So I practice in South Florida. I have offices in Boca, Kendall, Coconut Grove, and Hollywood. So you guys may be all over, but I'm very happy to answer questions at the end. And thank you for inviting me to do this lecture. This topic I do know a decent amount about, and I am very passionate about this topic because there really is no good treatment for it right now, especially in Western medicine. And so a little bit more about me. Some of the research that I've done is currently we're looking at using cannabis in the senior population, and we got $75,000 actually from the state of Florida to study how seniors are doing with medical marijuana. I've also done my own research using cannabis as a substitute for opioids in chronic pain patients. Hold on a second. Sorry, there's some noise outside. Okay. And then the other thing we're looking into, if anyone has any questions after, we can discuss water-soluble nanoemulsion. So this is a form of cannabis that has a faster onset. It's more effective. The body uses it in a more bioavailable way because cannabis is fat-soluble. A lot of times when we take edibles or tinctures, it takes a while to have any effect, and it may vary based on what we've eaten or when we've eaten. So we're looking at pharmacokinetics, actually blood levels of CBD and THC. And then I did a COVID-19 study as well, where we found there was more than 15% of people that had stopped vaping or smoking. And there's a huge interest in terpenes. So these are some of my areas of interest, and I'm also faculty. So I have students who rotate with me that are medical students at Nova.
Great.
All right, so onward. There we go. So So what exactly is fibromyalgia? So we all know that it's a chronic pain condition that affects multiple points of the body, above and below the waist, on the right and the left side. And the term really, fibromyalgia, it's really a pain in the muscles with potential fibrous tissue. So it's a very general term, and it's really one of those diagnoses that is a diagnosis of exclusion. So once we exclude autoimmune diseases or disc herniations, and once there's no pathology that tells us what fibromyalgia is, and usually it's associated with other psychosocial things. For example, depression or issues with sleep, chronic fatigue, or problems focusing. So even though it's really a disease that affects chronic pain and tender and certain trigger points in the body, there's many other things that fibromyalgia patients suffer from, which kind of had people, curious about what else is going on in the body. Why do they have multiple conditions or multiple symptoms, not just pain? And why can't we figure out, based on MRIs or blood tests, what actually is the cause? So there's this concept called central sensitization. And what central sensitization is really once your body has a certain trauma or a physical insult or even an emotional trauma, or maybe you're immunodeficient, for example. Once the body is in this state, if it doesn't really calm down and it continues to wind up, which means there's another trigger. Let's say someone, had an injury, they broke their ankle, then all of a sudden they ended up with a virus, and their whole nervous system is kind of in this hyperexcitable state where your neurotransmitters are not in balance. And this wind up phenomenon, it's like a loop that never really kind of stops. The concept of central sensitization is something that we really think is the cause of fibromyalgia. There's usually some type of trauma or some type of event that most patients can realize something happened, and then I never was quite the same, and then a series of other things happened, kind of like a cascade. It's not really with everyone, and sometimes they're not really able to identify it, but oftentimes we're able to figure out that this concept of hypersensitization or central sensitization is really the source of why the pain is not able to quiet down. And this is also why there's so many other factors related to just pain, why they're also having issues with sleep or focus or fatigue. Headaches is a big problem. And so Ethan Russo is a physician who really coined the term endocannabinoid deficiency syndrome. And what that means is that he thinks that, and they've done this using CSF, using cerebral spinal fluid. They looked at endogenous cannabinoid levels. So we all make naturally occurring cannabinoids in our body. And when we don't make enough, we have a deficiency. So if you had a deficiency in a vitamin, you would supplement with the vitamin. Similarly, if you don't make enough endocannabinoids, you have a deficiency. And a lot of times people who have an endocannabinoid deficiency have things like IBS, chronic fatigue syndrome, fibromyalgia, chronic migraines. And so there's been studies really showing that fibromyalgia is an endocannabinoid deficiency syndrome, which means one of the best ways to treat that is obviously to use cannabis or to increase our own naturally occurring cannabinoids. The interesting thing and the very frustrating thing about fibromyalgia is that many people, even physicians, don't even really believe in this condition. And I think the main reason why they don't believe in the condition is because they don't know the cause. And so if we don't know the cause, then how are we treating it? So they're FDA approved medications, but they're not very effective. A lot of times, family members or even physicians don't believe the patients when they have fibromyalgia. They say, well, you're just, you're depressed or you're not sleeping enough. And it's very frustrating for the patient, and when they don't feel like they're actually being heard or their symptoms aren't real. And so the real main reason is because this concept of central sensitization is very difficult to pinpoint. There's no blood test that shows us your endocannabinoids are low. And that's because it's much more difficult to measure this. And it's not really a snapshot in time of what's going on. That's just that moment, but it's a much bigger picture. So a lot of times the diagnosis takes a long time, maybe up to 5 years for people to be diagnosed. They usually see multiple specialists along the way. And so it can be very frustrating to finally get the diagnosis. But once you do have the diagnosis of fibromyalgia, the question is, are there any effective treatments? And so assuming that this endocannabinoid deficiency syndrome does exist, we all have an endocannabinoid tone. That basically means that our entire body is working to produce naturally occurring cannabinoids. We have enzymes that break it down. We have cannabinoid receptors. And so this whole system has to work to maintain homeostasis in our body. And then again, these states that are responsible for the deficiency, such as migraines, fibromyalgia, IBS, chronic fatigue, they don't really have great treatments. And so once you start using cannabis, the question really is, does it increase your endogenous cannabinoids along with feeling better, along with sleeping, or increase in activity, or your mood improves, or you're having less pain? So this really shows the 3 FDA approved medications for fibromyalgia: Cymbalta, Savella, and Lyrica versus cannabis. And so what you can see is that over 1,300 people with fibromyalgia were surveyed, and in green you see it's very effective versus red is not effective. And so you see that for cannabis, more than 60% said that cannabis was very effective in the fibromyalgia population, as opposed to the other medications, it's less than 10%.
That's
And
rather startling.
yeah, it is, because the question is, how do these medications become approved if they're not very effective? Usually in a lot of the pain research, you just need at least 1/3 of people to respond to say they have less pain in order for it to be statistically significant. However, that's also the same as placebo, right?
Right.
So it's interesting to see here how the people who surveyed said that cannabis was more than 60% very effective.
Yeah, that's interesting. I mean, the doctor may not exactly know, it's trying to prove what's going on, but you know you have a problem. Let's put it that way.
Right. Well, and then that's the problem, because a lot of times, even if the patient knows that something is not right, they're listening to their body.
Right.
I used to be able to, be active. I used to be able to do certain things, and now I can't anymore. When I touch certain areas of my body, I have pain. And what ends up happening is that the people stop believing them, because there's really no way of confirming a diagnosis. So their family members are skeptical. Physicians don't even believe fibromyalgia really exists. And then honestly, specialists are just trying to figure out where to send these patients to. We used to have a fibromyalgia clinic, and it was just for patients with fibromyalgia. And a lot of times, after they were ruled out from any autoimmune disease with rheumatology, they were sent to pain management. And after imaging was done, and other things in the spine were ruled out, then they were sent to the fibromyalgia clinic. But the problem is, it was just a rotation of these different FDA approved medications that aren't really effective, anti-inflammatories, muscle relaxers, that all have a lot of side effects, and again, not getting to the root cause of that central sensitization. And it's interesting, when you really get a good history on someone with fibromyalgia, there's usually some emotional or physical trauma that started at some point, and then it just kind of spiraled. And that whole wind-up phenomenon is really a very interesting concept, because for certain people, their nervous system just doesn't quite calm down, and it's kind of like the perfect storm. And so cannabis, is coming at a good time for the fibromyalgia population, but we also need the right tests, so that there's justification for why cannabis does work. If we're able to really do good clinical trials to understand endogenous cannabinoid levels, then we're able to not only see that their levels may increase after taking cannabis while their symptoms are improving, but also that they were deficient from the beginning. So here are some studies specific for the fibromyalgia population and cannabis. And obviously we have a lot of challenges when doing research with cannabis, given the fact that it's a Schedule I drug. And so I would say one of the best studies was in 2014, the National Pain Foundation, the 1,300 fibromyalgia patients, and a third of them reported using cannabis and saying that it's more effective. And this study is another good one in 2018. In 2018, they gave fibromyalgia patients just less than a gram per day, which is a decent dose. But there's actually studies done where they're even giving them 1 milligram a day, and almost microdosing people with THC. So obviously it ranges based on how sensitive patients are to THC, and if they're cannabis naive or cannabis users. But there was even another study done more recently that showed that even just taking 1 milligram of THC a day for fibromyalgia patients will decrease pain over time. And that really is because of, if it is an endocannabinoid deficiency, by giving your body the THC, it's allowing your body to make more of your naturally occurring cannabinoids. And so it's kind of that negative feedback loop. And it's interesting because it's almost like microdosing. So instead of, with fibromyalgia, we treat the symptoms. If you have pain, you'll take, 5 milligrams of a 1-to-1 tincture, or at night, you'll take THC indica 5 milligrams in an edible or a capsule of 10 milligrams to sleep through the night. But really just taking 1 milligram at least a day of THC in a microdose can be effective to prolong the progression and to really reverse a lot of the symptoms.
And it's really sad that we're not, because it's a Schedule I drug here in the United States, we're not able to do a lot of research in this particular, not just this area, but in cannabis in general. I mean, you look at the studies, they're Germany, Israel, it's really too bad that we're not able to participate in that party.
Right. And if we were, we still are using the government's 4% THC that, when they've used that in the past, they've even found mold on that, University of Mississippi's cannabis. So really even studying the cannabis that the government allows us to study is really not what patients are using in the dispensary. And so even if we were to use that, we're not going to get the results that we want to see. So it's almost like we have to use patients that are using the dispensary, which, then it creates some issues as well. And also cost is a problem. So that's why the concept of even just microdosing on a daily basis, a small amount of cannabis can be effective. And then when you need it, larger doses for symptoms, then you're able to use it. Sure. So what I mentioned a little bit earlier was that we all have an endocannabinoid system. And so once physicians and medical students are taught that we all have a system in our body that really is kind of based around the cannabis plant, it opens up their eyes to the potential for using cannabis in a therapeutic way and not as recreational. But really the THC molecule is very structurally similar to something called anandamide, which is the bliss molecule or a naturally occurring cannabinoid. And so we make this from other free fatty acids in our body. Our diet, can actually contribute to making more naturally occurring cannabinoids. And so similar to anandamide, THC, when we take it by mouth or vaping or smoking or any other form, it binds to the cannabinoid receptors. And so we have receptors in our brain and our spine, that's the CB1. Then we have the CB2, which is more in our immune cells and our muscles and other organs. And so the THC binds directly to the cannabinoid receptors. As you see, CBD, it doesn't bind like a lock and key. It actually inhibits the enzyme that breaks down our naturally occurring cannabinoids. So if we all have anandamide, we want that to stay around in our body for a longer period of time to maintain homeostasis. It really is helping to regulate all of our neurotransmitters. So CBD becomes more of a modulator of the system where THC actually activates it. And that's another reason why a lot of times when people use just CBD as an isolate, it's really not as effective because you're still not stimulating your cannabinoid receptors. You may be promoting homeostasis by promoting more of your naturally occurring cannabinoids, but again, you're not activating the actual cannabinoid receptors. And then, you'll see CBN. Now some dispensaries have CBN. That's a great cannabinoid for sleep and also pain. And that's a study that I'm actually starting with the University of Miami. I think CBN has a lot of promise and potentially for fibromyalgia patients as well. And so this is really to give you an idea. You have endocannabinoids made in the body, and that's from different foods like fats. You have phytocannabinoids, that's from the plant. And then you have synthetic ones like marinol. And so they all can activate your receptors. And then the point is really, if you take cannabis because you're deficient, over time, you'll probably be able to decrease your dose of cannabis because your body will start making its own. And that's really the goal, is not to get you dependent on cannabis, but actually just to kind of use cannabis as a crutch during the time that you need it, and then hopefully promote wellness and decrease a lot of the symptoms, and then take a lower dose over time.
I should mention, I'm a senior citizen, and I think my body is not producing the endocannabinoids that it was producing before, to be candid with you.
Well, that's actually one of my last slides. That's 100% accurate. As we age, we make less endogenous cannabinoids, and so that is actually the reason why older people have chronic disease and younger people don't. Our endocannabinoids are able to maintain homeostasis. They're able to regulate our neurotransmitters when we're younger. When we get older, we don't make as much naturally occurring cannabinoids unless we're supplementing with the cannabis plant, and therefore we're actually out of balance, and that's where chronic disease comes into play. So it's a great point.
Yeah.
So
I didn't mean to steal your thunder.
oh, that's a good point.
Yeah.
So the actual plant is made up of a lot of different components. We have cannabinoids, terpenes, flavonoids. The cannabinoids, that's THC, CBD, CBN, CBC, CBG, and the terpenes are really the essential oils of the plant. So we say it's more like the engine and the steering wheel, right? So like the cannabinoids are the steering wheel, the terpenes are no, the cannabinoids are the engine, and the terpenes are really steering it. So if you want to sleep, if you want less pain, if you want energy, that all depends on the terpenes. The terpenes are the essential oils of the plant. They guide the effect, they give it its smell, and they have a synergistic effect, which we call the entourage effect, so that multiple components of the plant working together will have more benefit than an isolate by itself. That's why, again, a CBD isolate doesn't compare to whole flower. So when we talk about terpenes, there's great terpenes like beta caryophyllene. This is actually a CB2 agonist. So this actually is a terpene that activates our cannabinoid receptors. It's very good for inflammation. Then we have things like myrcene. Myrcene is what makes an indica. An indica, it's a terpene that is a little bit more responsible for sedation and also pain management. Linalool, found in lavender, also good for relaxation. And limonene, like lemon or citrus, is more uplifting, more of a sativa type of terpene. So it's important to understand the terpenes because they can really help minimize the need to use THC. They could help really get to the effect that you want without as much of an intoxication. So in Florida, we have different qualifying conditions. And as you can see, chronic pain or fibromyalgia is not a standalone condition. You would have to have one of the 10, or you can have something like one of the 10. So a lot of times, chronic pain, the most common reason patients get their medical card is chronic pain, then anxiety, then insomnia. And those three are not qualifying conditions. A lot of people, unfortunately, are put under a symptom related to one of the 10. So let's say patients with multiple sclerosis have neuropathic pain, or they have muscle spasms. Then we put pain patients similar to MS, or if you have anxiety, it's similar to PTSD. So this is the way it works in Florida. It is more paperwork, but in the end, it really helps us get more get more conditions. So instead of being as rigid, the number 11 medical conditions of the same kind or class really work in our favor.
I think that's where Florida really got it right. What they did was they really gave to the doctors the capability to make the decision of whether cannabis is going to help this person or not, rather than trying to list 400 or 500 different conditions that are out there. I think that's one of the benefits of our particular system is it makes it is more paperwork, I know, but on the other side of the coin, it does let you treat more conditions.
No, it's true. I think a lot of people complain about adding more conditions. And in my opinion, we have, there's anyone with a chronic debilitating condition can pretty much qualify. That's how I look at it. So Florida actually did do it right in that sense, to leave it up to the physicians. And then a lot of us really are on the same team. We help each other with the paperwork so that, everything moves smoothly. It's just a matter of educating the patients that they still qualify, even if they don't have cancer or seizures or, something like that.
Yeah, I think it's important to point out, if you don't see your condition on that list, still go see a medical cannabis doctor. Don't be afraid to go see them.
Right. That's true. A lot of these are neurological conditions. And a lot of people don't have one of the 10, but really the same kind or class. I mean, and again, chronic pain, as a pain physician, that's most of my patients. And so there's ways, and a lot of times a patient who has chronic pain also has another condition. Maybe they have glaucoma, maybe they have PTSD. So even though it may be the reason you're using cannabis, you may have another condition which you would qualify. Mm-hmm. And so we use medical marijuana for multiple types of pain. So it's great as an anti-inflammatory. It's, in the sense that it doesn't have the same side effects as NSAIDs. It doesn't cause GI bleed. It goes through our liver, not through our kidney. And so it is a good anti-inflammatory, and it also causes, it's also looked at as an anti-inflammatory, not just in, let's say, our joints, right? Not just in our knees and our hips and our shoulders and our spine, but we have inflammation throughout our entire body. So it's a great anti-inflammatory even for the cardiovascular system, for our GI system as well. And then as a muscle relaxant, for example, there's a medication called Sativex, and they use this medication in many other countries. It's a 1-to-1 preparation for MS patients with spasms. And the other thing we use it a lot for is neuropathic pain, for peripheral neuropathy, for sciatica, for radiculopathy, anything with numbness, tingling, burning, that, gabapentin, Lyrica has so many side effects. So we use usually a 1-to-1 CBD and THC for nerve-related pain. And this is also a great statistic that medical cannabis states experienced 25% less overdose deaths than states where medical cannabis is illegal, which means that once a state has a medical legal program, there's 25% less overdoses because less people are using opioids. And that's, right now we're trying to have other ways of helping, the opioid epidemic, and what else can we use for treating chronic pain? Because honestly, opioids are great in acute situations. If you have surgery, if you break a bone, if you have a trauma, opioids are great for acute pain, but they're not really meant for chronic pain. They have a lot of side effects, constipation, cognitive issues, endocrine issues. So there's a lot of side effects, and the fact that you can overdose. The cannabinoid receptors are not in our brainstem. There's no respiratory suppression. So it is actually very safe. There's no lethal dose of cannabis. So cannabis can really be a substitute for opioids. And, more and more studies are actually showing this. And the other thing that is unfortunate is that physicians don't realize that there's no problem with someone on opioids who's also using cannabis. There's no way of getting off your opioids without having something to add. And honestly, I can't even tell you how many fibromyalgia patients I've seen that are referred to me that are on opioids, which really makes absolutely no sense, because in the sense of fibromyalgia, there's no reason to ever start someone on an opioid. That's not going to do anything for central sensitization. That's not going to help their chronic pain. It's not an acute condition. So it just creates a dependency or an addiction. And so usually we need to add the cannabis in order to taper them off the opioids. But a lot of pain doctors, once they see that their urine was positive for THC and they're on opioids, they'll kick them out of their clinic. The way I do it is I really just try to figure out how much of a 1-to-1 ratio of CBD and THC the patient needs to really take over their opioids. So let's say someone's using Percocet 5 milligrams, for example. We start off between 3 and 5 milligrams of a 1-to-1, and we really just take one time a day. So if they're taking 2 or 3 pain meds a day, we pick one time. We say, okay, we're just going to use a tincture at this time, and let's see if we can get the same, or if not better, pain relief than you would from your opioid. There's not going to be any withdrawal. You're still going to be taking the medication, but it's just really a slow taper off of the medication. And the nice thing is that it also helps with the opioid withdrawal and potential side effects from decreasing the meds in terms of the restlessness or issues with sleep. So I always add the cannabis, and then we taper off the opioids. We've seen that more than 40% of people completely wean off their opioids, and another 40% decrease them significantly. And there's also a huge substitution effect with sleep meds and antidepressants and anti-anxiety medications as well. And so this was a great survey, almost 3,000 patients who were getting their medical cards. Pain was the most common reason, then anxiety, then insomnia, then depression. And so 30% were also using opioids, and 97% said that when they were using cannabis with their opioids, they were able to decrease their opioids. 92% felt that cannabis side effects are more tolerable than opioid side effects. 82% felt that cannabis alone is better than combination, and 93% would choose cannabis over opioids. So this is like a great survey that was done. And again, we're talking about fibromyalgia, so I really shouldn't be bringing up opioids, but I can't even tell you how many patients with fibromyalgia are on it. And that's just because there's no good FDA approved medications. They're not effective. They're not getting to the root cause of the problem. and this is what's covered by insurance, and that's really very unfortunate.
Well, I think what you're pointing out is that the cannabis can be an exit drug, not an entrance drug. That's what you're really finding out that's out there. And there's this study and there's other studies that are out there. We're doing a webinar at the end of March on cannabis as an exit drug, how to get off cannabis. But I think you brought up a good point. A lot of doctors are kind of discovering now that the one condition, one pill solution may not necessarily address all the conditions that are out there, and fibromyalgia is an example of that.
Right, and a few things. Like, people are used to this whole concept of a daily dose, right? Now we've gotten everybody used to your daily dose of your antidepressant, your daily dose of your pain medication, and that's really not the way it should be. And so we're really trying to get rid of this mentality that we need a daily dose to treat a chronic condition or even reverse something. And in terms of the exit drug, it was only a gateway drug when we didn't have a medical program, because you would go to your someone to buy cannabis, which you would think is recreational, but usually most people are using it for something therapeutic, whether it's to relax or to sleep or have less pain. And so it truly is an exit drug because it allows us to get off our other pharmaceuticals. But now that we have a medical program, there's no gateway, because when you go to the dispensary, it's only cannabis, right? So I do want to differentiate, people who get their medical cards, what's different from a dispensary versus buying CBD oil online, or, even in a good CBD shop. So now in the state of Florida, the Department of Agriculture makes it mandatory for everyone who sells CBD to get a permit. And that permit makes sure that they're checking their batches of oil every single time. Everything goes to get a certificate of analysis from a third-party lab. And so that's extremely important, because the studies have shown that before this was regulated, more than 70% of tinctures had incorrect milligrams of CBD, whether they had almost nothing or too little or too much THC. But the market really needed to be regulated, since it's not an FDA approved medication. It's looked at almost like a dietary supplement. So CBD, by definition, hemp has to have less than 0.3% THC, so there's no chance of intoxication. And it is, it can be great for fibromyalgia patients. If a daytime dose of CBD can be great for pain, for inflammation, but also it's really supposed to be looked at as a wellness supplement to keep your endocannabinoid system in balance. It's the way that we're going to prevent chronic disease, or even prevent things like fibromyalgia. So it just matters where you're getting the CBD from, if it's lab tested, and the quality of the product. And so differentiating between CBD and THC, which are the two main cannabinoids in the plant, the CBD doesn't bind to the receptors, but it actually has this nice effect where it takes away some of the high you get when you use THC. So it's actually one of the few things that can decrease the intoxication. So if someone needs THC for pain management, or if they need it just to actually activate your cannabinoid receptors, if you use the same amount of CBD, or 2 or 3 or 4 or 5 times amount, it's going to take away the high. It's going to decrease the high. And so when the THC binds to the receptor, if CBD is along with it, it'll make sure that it changes the shape a little bit, so it doesn't bind quite as strong. It doesn't do quite a lock and key type of thing. And so that's a really important key for people who want to use cannabis during the day and not be high, not be sleepy, is to use it with an equal amount or more of a higher CBD to THC ratio. It's good for inflammation, helps with stress and anxiety, for pain, also as an antioxidant. And then the THC, since it does bind to your cannabinoid receptors, we use this to stimulate appetite, to treat nausea and vomiting, as a pain medication, and also for sleep. This is an example of a dispensary, in case we have people who are not patients on this webinar. This is one of our dispensaries that has almost, I think, 75 stores in the state of Florida. I think we have about 22 licensed dispensaries now, and probably like 16 that are actually dispensing. You do need a card to get into some of the dispensaries. Some you can actually walk in and get information from. And then there's all different routes of administration, and that's really important. It's really the cannabinoid CBD to THC ratio, the milligram, and then the route of administration. It's not just smoking cannabis flower, right? That whenever we use inhalation, we're not really able to get the milligrams. And so the actual cannabis plant has more THC. And so it's very unlikely that if you're using the flower that you're not going to get the intoxication, which is not always looked at as it's looked at actually as a negative side effect. That's how the DEA regulates it. But really it's more of a chance for expansion of consciousness and a form of connection. So I think a lot of people now especially do need that form of connection. And a lot of people who are suffering or depressed or in pain like to I would say be present. Some people say it's escaping. It's really not an escape when you're present. It's just that we're not used to being present because a lot of times we're thinking about the past or worried about the future. So it's a nice moment to be present. But in terms of the route of administration, on the left you see tinctures. The bottle is it could have a bottle with oil in it. It could be CBD, THC, or any ratio of the two. That's generally the first one that I start with. The reason why is because we're able to be flexible with the dose. Capsules usually come in 10 milligrams or 25 milligrams, but with the tincture, you can use 3 or 5 or 7 and kind of titrate the dose up. It's something that you put under your tongue. Using it sublingual has an effect usually within 30 minutes, but then you do swallow it and get that first pass effect. So it can last usually up to 6 hours. The capsules are great for sleep, for example, or for something long acting. They take about an hour to kick in and last maybe 6 to 8 hours. Topical creams are great, especially during the day for people who don't want to use other forms of cannabis. They can use topical creams on an area that hurts them, or also they have systemic patches that you can put them on your wrist or your ankles. And that has a lower bioavailability, but more of a systemic absorption. They just happen to be very expensive. And then there's vapes. So any form of inhalation works within 5 or 10 minutes. It goes straight into our lungs, into our bloodstream. There's nothing else there that's affecting how fast we're able to feel the effects. And the issue with vaping was really for non-cannabis dispensary products. That whole lipoid pneumonia, people were putting in vitamin E acetate as an additive, so that when people would exhale, they would see these big puffs of smoke. And so vaping has gotten not a great rap because of the recreational market. However, we don't really have longitudinal evidence about what vaping is going to do. It's always safest to use something that doesn't have cutting agents or additives in it. And I a lot of times just tell patients to buy a vaporizer and put whole flower in it, because flower has the entourage effect, and by vaping you're able to keep the temperature at a lower temperature, unlike using a lighter where carcinogens are entering the lungs. So vaping flower is also an effective way of using cannabis.
I should point out, if I can for a second, you can also mix and match dosing methods. And I say that because in my particular case, I have 7 herniated discs in my neck, thanks to the ambiance of an automobile accident. And when I wake up in the morning, when I first got it 4 years ago when it happened, I'd wake up in the morning with a level of pain of 7 or an 8. I would take the drops, take the tincture oil, but that would take 20 or 30 minutes to work. So I'd grab a vape pen, take literally 2 hits out of a vape pen, and within 2 to 3 minutes, my pain level would go from a 7 or an 8 down to a 1. So I was using routes of administration, one that worked effectively, but only worked 2 hours. The other that took over after 30 minutes, it lasted for 4 hours.
That's a great point. I call it layering. Everybody has their own terms, but I call it layering. So I'll tell a patient to vape or smoke at the time they want to go to sleep, and at the same time take an edible or a capsule, so that by the time you fall asleep from the inhalation route, then later on the form that you were able to take by mouth will kick in and then last longer. So it's really, again, how fast you want it to work and how long you want it to last. Or I'll tell people to take a lower dose, like let's say a 5 milligram edible, like half an edible, and then that's kind of around in the background. And then if they have acute pain or if they have an exacerbation of something, they can always vape or smoke on top of that. So it's good to layer it. So whenever I have a new patient, the questions are always, have you ever used cannabis before? And how's your sleep? Are you working during the day? How's your energy levels? So we always start low and increase it slow, especially if the patient is cannabis naive. if patients have been using cannabis for a long time, they still may not know a lot about the plant. They may just love it, but they may want to know a little bit more about how to make it specific for their condition or for the symptoms that they may have. It's always good to be consistent. Like, if you take something for sleep at night and it doesn't work, you can take the same dose again. And then if that doesn't work, then we increase the dose over time. And then it's really understanding how much CBD do you need to mitigate the intoxicating effects of THC. As we increase the dose, patients feel better. Then everybody has a sweet spot, a spot where they know this is the right ratio, the right milligrams. And then if you take too much THC, more is definitely not better when it comes to cannabis. You can get sleepy, you can get anxious. So it's important to understand where your sweet spot is. And over there, also there's a concept of oversaturation. People who use cannabis very often, everybody has cannabinoid receptors. If you use too much of the cannabis, then, or especially the concentrates or too much THC, then you're basically occupying all your cannabinoid receptors. So you're not going to feel the same effect. So this is basically like, tolerance, or really dependence over time. And so even just taking 2 days off can reset your receptors so that you're able to start off at 50% of where you were before. And then there's all different terpenes which dictate whether it's kind of a sativa or an indica, and we're kind of getting away from these names. But for right now, it's just kind of easy for a lot of people to work with these terms. That indica, the mnemonic is in the couch. It's more for sleep, more for pain, and sativa is more for energy, more uplifting. And so this goes to the point that you were mentioning, that as we age, we make less endogenous cannabinoids. And I think that the population I see most are people who are definitely over 50, but a lot of times over 65. And I think it's because they've tried and failed multiple things and they're frustrated. They just want to, another option. A lot of times their grandkids will send them edibles from Colorado or California, and they'll take that and say, I slept all night, which always scares me because edibles stay a long time in your system. They convert in your liver to a more potent form of THC. So it's never the best idea to try an edible first. But, and people forget that they can always break that in half. But either way, I think that the elderly population are using it more and more now because, many, many reasons, but also the fact that there's no chance of overdose. So as long as they're using their CBD, or as long as they're in their home with somebody else, then it's very safe. There's no issues with respiration.
Well, you also mentioned you have CBD, you aren't using THC, and you're getting a negative reaction from it. You should take some CBD, and it'll help counteract that.
Right. And so that's why I always tell patients who are new to cannabis, just everybody buy a bottle of CBD. If you use it, great. If not, you can always have it there as a rescue. It's almost like a Narcan for opioids. It's something that can revert, or like an EpiPen. It's something that can reverse the high, make people feel more comfortable, or be that buffer in the beginning, but when people are slowly trying out the THC. So I will bring this up because a lot of people get worried that they're using cannabis and now they're going to get addicted to cannabis. But really, in the literature, it says that it's a 9% rate of dependence. And it's not really an addiction, because if you were to smoke every day or use cannabis every day and then stop, you wouldn't go through withdrawal. This number is really not a very accurate number. It's really based on the amount of people who are arrested for possession of cannabis, who go to a rehab facility. I think that there's been great studies just showing how CBD can decrease cravings. They use it for alcohol. There was a study using it for actually in a preclinical trial in rats looking at cocaine, and how CBD can decrease the craving as the rats were, pressing less on the lever. And so in general, I'll tell patients to take 2 days off to kind of reset their receptors, or I'll tell them to take a week off every 3 months, which is kind of difficult, but that will really help to restart their endocannabinoid system so that they're having more of an effect.
I want to make a point on that. I use medical cannabis because I have, again, I mentioned the herniated discs in my neck. I have 7 of them, and I also is the ambiance of having knee surgery done a couple of years ago, and of course you get that. That's always a fun experience. What I think it's important that like every 6 or 8 weeks, I'll take like a day or a day and a half off, like you said, just to reset my body. That's my objective. I'm not addicted to cannabis. I can stop and I don't have any withdrawal pains. I don't have anything like that. What I do have is after about a day or a day and a half, my neck taps my body on and says, "Hi, I'm here. The pain is back, and you better do something about it." I think that's what I find interesting. Is it's a cause and effect. I know that if I use it, I have not only less pain, but also I'm less irritable because I don't have less pain. It helps me do my job on a daily basis or live my life and spend time with my wife. So
Right.
I think it's not an addiction to cannabis. It's an addiction of getting rid of whatever lifestyle altering condition you have and really being able to tame that animal.
And it's also a dependence in the sense that if you don't have it, you miss it. But it's not an addiction where if you stopped it, you will go through withdrawal.
Right.
And it's not a dependence in the sense that you don't absolutely need it. It's just why wouldn't you take it if it's helping you? Because people who suffer from pain, then it affects their mood, it affects their activity level, it affects their sleep. So that's the beauty of cannabis, and that's kind of what physicians have to get familiar with. Is we're used to these single molecule drugs that just activate one receptor. And cannabis is one that activates many receptors, not just the cannabinoid receptors, but CBD can actually activate up to 65 receptors. So it's something that has multiple effects. And that's why I always say it's one plant that can do many things. And a lot of times in the fibromyalgia patients, you actually need most of those things. So I kind of began to talk about this in the beginning, but usually I say that they use cannabis as a crutch initially. It's something that is helping them in the moment as they're starting to feel a little bit better. It's something that can really help us be resilient to stress. So that alarm system in our body that goes off when we have pain or when we have anxiety, it's able to kind of to quiet that a little bit so that we're able to deal with more before our nervous system goes out of whack, let's say. And it's really understanding that chronic pain is not just physical tissue damage, but there's an emotional experience that goes along with that. So someone has chronic pain and now they're living in a body that is causing a lot of emotional changes, or they had a specific condition that's caused pain, and they have a lot of people have post-traumatic stress disorder from a physical trauma, and then there are triggers that are occurring throughout their lives. So it's really this interplay between the peripheral and the central nervous system. And so that's why over time I really do encourage patients to not be scared to use a THC. The ability to alter consciousness can actually be looked at as a benefit of this plant. And especially now when everybody's isolated, it's a nice time to be able to connect with yourself. And it's really amazing how within a few minutes of using cannabis, you can just have a totally new perspective on things, or your body can feel very tight, very tense, or you may feel anxious, or you may have pain. And by just using it within minutes, it's like, a whole new picture has opened up. And then the concept of neuroplasticity is very important these days. There's something called brain-derived neurotropic factor that increases in when you use cannabis and actually other psychedelics as well. And the concept really is that a lot of the thoughts and the ways that we feel yesterday are the same that we'll feel tomorrow, and the way that we feel today. And so if we're able to create times when we're not having pain, or times that we feel relaxed, or times that we're able to rest, then we're able to go back to these moments in the future. And by just kind of practicing this, just practicing feeling well, is something that will allow us to feel well for more time. So that concept of neuroplasticity, our brain is plastic, our nervous system is plastic. Where even genetic things, there's a lot of things happening with epigenetics, things that are actually affecting our genes related to our environment or toxins or pharmaceuticals. So we have a lot to say, is my point. Even if patients feel very frustrated or hopeless, there are options. And even just using cannabis is a way for people to feel not so stuck. And practicing this concept and practicing this feeling is the way that neuroplasticity works. So the point is really how to maintain balance, right? How to maintain homeostasis. I think that with cannabis, we're able to empower people to take their health into their own hands. And what that means is, a lot of times patients are scared. Well, how much do I take? And what if I feel high? What am I going to do? This is one of the safest plants. It really is. But it's also nice to take ownership over your own body and your own symptoms and say, well, I know now that this product affects my body in this way, and I'm going to use this many milligrams at this time of day. And so usually patients have like a medicine chest of cannabis. They have some flower, they have a vape, they have a tincture, maybe some edibles or capsules. and as over time, they're able to really understand how sensitive they are to THC, how much CBD they need to buffer that. And then they can say before they choose to medicate, how am I feeling? What product would be best for me right now? How soon do I want it to work? How long do I want it to last? And that really comes from education. The initial consultation with any
It's
cannabis
interesting
physician, it's
how
all
people really
education.
should be listening to their bodies. What you're bringing out is if people can listen to their bodies, they can actually help really, I wouldn't say heal yourself, but you can find out methods that will be able to heal you. And I think you're right. With cannabis, using a little more, for example, CBD to address inflammation, maybe a little THC to address some pain, being able to find out what your ratio of what works and what doesn't work. That, I think that's really important. But only you can be able to know what that is because every person's body is different. Your biology is different from everyone else.
Yeah, no, 100%. I mean, a lot of times I'll see a patient and then by the time they get their card, they send me an email and then what should I buy? Even after I discuss that. And then once they buy it, when should I take it? And I want to just say, open your mouth and put the medicine in your mouth because the only way I'll know how you're going to feel is if you take it. And I always am very careful and I will start people on a 3-to-1 ratio, a higher CBD to THC if they're really nervous about that, or even a good CBD product in the beginning, or a very low dose of a 1-to-1 in the beginning. But until that person actually takes it, we don't know how sensitive they are to it. And so I've been very surprised. I have 90-year-olds who take 10 milligrams of THC at night and have no high, and they're, wondering what does it mean to be high. And then I have young people who need like a 10-to-1 ratio to even take any THC during the day. So every person's body is really very different. So it's interesting, but it really is something that is self-titrated, and people just have to be comfortable with this concept. And that's not the way that we've gotten used to taking medication, and that's not the way the physicians work. And that's not the and patients are expecting a prescription and a milligrams and a one size fits all. And that's really why we're not able to, like, I wanted to do a study, what should we use for fibromyalgia? So let's say, for example, a 10 milligram 1-to-1 capsule 2 times a day, right? If someone's been on cannabis for a long time, that may not help them. If someone's very cannabis naive, they may be high all day. So it's really difficult to make an FDA approved medication for fibromyalgia or any other condition because there's so many factors that go into play of that specific person's endocannabinoid system, not just the condition.
Yeah, I mean, cannabis really tunes into your body. Cannabis really gets your body to listen to itself. And I know people ask me, what should I take? And I basically say you have to figure that out yourself. It's kind of like, I have friends who take alcohol, for example. I have a friend that literally, if he has a couple shots of vodka, he's done for the night. And I have other friends that can drink the whole bottle of whiskey, and they're not even affected. It is really a personal thing. And so that's what you have to find out about cannabis, what works and what doesn't work, just like you would with alcohol. You find out what you like and you don't like and what your tolerance is. But once you find that, and candidly, once you tune into it, once you do find that sweet spot, you're getting your life back. It really is a life-changing experience.
Right. And I say it's like a catalyst for change, right? So once a person starts taking cannabis, many things happen. They start realizing, oh, you know what? I should exercise a little bit more. Let me get my sleep to actually, get 8 hours of sleep and go to sleep at 10 o'clock at night and not stay up all night. Or let me start meditating, or nutrition changes. Maybe they start paying more attention to what they're putting in their body, when they're putting it in their body. So I really think it's a plant that kind of opens you up to these lifestyle changes that, for many reasons, people start feeling better and they want to be more active. But also, if they're spending the money and the time trying to, allow themselves to feel better using this plant, then they should be looking at the rest of their diet and the rest of the amount of time they move. And I think that people are they want a magic bullet. They want something that's going to fix their symptoms, that's going to be 100%. And the fibromyalgia patients just get hopeless over time because really nothing has helped them. And so this really helps with so many of their symptoms, and also can, in my opinion, really reverse it.
I think also, it's a situation where when you start using medical cannabis, it's really important to really look at it as it's not a silver, it's not a magic wand. It's not a silver bullet. What it is it's something that is more like fairy dust. That what's going to do is it's going to start a process to really help you really listen to your body, but also pay attention to how you eat, pay attention to how you exercise, pay attention to your mental state. That has a lot to do with, that has about as much to do with it as taking cannabis itself.
That's a great point. There was actually a study done that showed that people who exercise, so your naturally occurring cannabinoids increase when you exercise. It's not just your endorphins that make you feel good when you exercise. However, the study showed that when people were doing an exercise that they weren't enjoying, there was a blunted response. So their endogenous cannabinoid levels didn't increase at the same rate as it did when they were enjoying the exercise. So, things like that are actually very important, that when you take cannabis, yes, maybe it's increasing your endogenous cannabinoid levels, but also there's things that we can do like meditate or yoga or breath work or even exercise that can increase this as well. And diet is a huge factor because that actually produces fats, which plays a role in producing endogenous cannabinoids. So I'll end with this, which we kind of really touched on, which says no matter how much it gets abused, the body can restore balance. The first rule is to stop interfering with nature. The plant is a plant that we should all respect. We should respect the way that we're consuming it. People, in my opinion, overconsume it. Everybody should really find their sweet spot, but also the fact that we shouldn't be nervous to use this plant. Everything now is being lab tested. Everything is safe. We're really understanding much more about how it's affecting us. And we also are frustrated with a lot of Western medicine. So, I'm looking forward to seeing how big pharma is going to try to regulate cannabis. But for right now, I think that we have a great program in Florida, and we have a lot of great dispensaries. And, I just think cost is the biggest issue when it comes to cannabis.
And I think also important to point out, no one has ever died from using medical cannabis. The World Health Organization has shown that hasn't happened. So why don't we do this? Why don't we stop sharing the screen and get into some questions? How's that sound?
Sounds good.
You want to start?
Sure. Let's see.
And by the way, I want to thank everybody for providing questions, and please feel free to add some if you have as we're going along. Where our objective here is not only to provide information about fibromyalgia, but also to answer your questions. So please.
So in terms of strains, there's actually actually have a slide about. I think we stopped sharing, but can I start sharing again?
Go ahead.
Let me
you should be able to. Yeah.
Share screen.
If you don't have a slide, I have a slide. There you go.
You actually had a slide that actually showed the strains that are best for fibromyalgia. Let me see.
I think it's up a little bit.
Here.
There you go.
So I'm not a huge fan of the strains, and I'm not, and physicians are starting to call it chemovars, varieties of these certain chemicals, or cultivars instead of strains. But in general, I'm not a fan of the strain names, because if you go to one dispensary and you go to another dispensary and you get the same strain name, it may not actually have the same composition. I think that for the most part, a product that has some CBD, some THC, and usually some myrcene and beta-caryophyllene, to me, are the terpenes that are best for pain and inflammation. And I love beta-caryophyllene because it does activate the cannabinoid receptors. It's a great anti-inflammatory. And then myrcene's great for pain. And that's also more of an indica. So I would say that usually I would look at the terpene profile and either use something that has more myrcene if it's at night, something with beta-caryophyllene definitely. But what I have seen, like things like Blue Dream and Girl Scout cookies to be great daytime strains, and then something like Granddaddy Purple or 9 Pound Hammer are great for nighttime.
One of the things that I found amazing about when I first started taking cannabis was I went into the dispensary, and of course the doctor made a recommendation. I knew nothing about it per se, and I I talked about my condition, and the person behind the counter said, "Here's what you should take." And I thought, and so I did. You know, I just took it and it did work. And I came back the next time and I said, "How did you know? You know, what piece of magic was here that out of all the bottles and all the things you see, did you hone in on that one?" And it was very simple. They looked at what my condition was. They looked at the terpene profile that was there, and they looked at the cannabinoids that were there. And so it was kind of a matching process. And there's some CBD wheels and terpene wheels that are out there that help people, but there's actually a science behind it. It isn't just grabbing a product off the shelf and saying, "Here it is."
Yeah, there's a company that I work with called Endocanna that does a genetic swab. It does like a swab to get like a 23andMe, and it kind of gets you like all of your genetic information about how cannabis, how your body would use cannabis, and so what would be best for you based on the condition you have and based on your genetics. So some people have genetic mutations where they're predisposed to depression or pain, or sometimes certain enzymes in our body we don't metabolize well. We're poor metabolizers or fast metabolizers. So all of those things are kind of important. So when someone's very frustrated, sometimes I'll run that test for them just to get an idea that maybe, you know, what normally would work for most is not working in them, and maybe it has more of a genetic component. So in general, you know, someone's asking more specifically about their regimen. I like CBN for sleep and pain at night, usually around 10 milligrams. I definitely think CBD is very important. So if someone is taking just THC for fibromyalgia, I think that, you know, at least 25 to 50 milligrams of CBD is probably effective or enough for someone like that. But everybody is very different. I do love the nano water soluble products. I think that the ability to bypass everything that's going on in our GI, the fact that so many people with fibromyalgia also have IBS, or, you know, may have other GI issues. If people don't have gallbladders and they're not making bile salts, for example, if their diet is poor, or they have SIBO, small intestinal bacterial overgrowth, all of these reasons may be reasons why taking capsules or edibles or even tinctures are not going to be as effective. So once something is water soluble, it has a faster onset, but also it's bypassing everything that's going on in your GI and even lipid metabolism, and actually bypassing your liver. So I'm a big fan of the nano products. And also, you know, like we talked about, layering it, having something long acting and then short acting for acute exacerbations. So someone's asking that they don't have one of the 10 conditions, but and Mary's medicinals are not available. Let me see. Hold on a second. So even if you don't have a one of the 10 conditions, most people do qualify because chronic pain, we can say that your symptoms are similar to one of the 10. So that's, you know, that wouldn't be a reason not to get your medical card. Patches, it says Mary's medicinals are not available. There is one dispensary called Liberty Health that was carrying Mary's medicinals. Now, starting in a month or two, MedMen, they'll start selling Mary's medicinals. So I guess they
E-commerce website called My Botanical Wellness, and we sell Mary's medicinals on that website.
Oh,
so we'll
great.
send that out. We'll send that out as in the follow-up information. We'll give you the link to that, and it's part of our patches and things that we have.
I love the patches. I think sometimes they're a little bit expensive. You can cut them in half sometimes, and they're just as effective. But Mary's products, I would say, are probably my favorite products for topicals. This Dawn says, I had a medical marijuana card in Illinois. I have fibromyalgia, Crohn's, and rheumatoid arthritis. I had little advice in Illinois, so I wasn't sure what to use. Now I'm in Florida, was exploring getting a card. So getting a card, it's $75 to get a card once a year. That gets paid to the state. Most physicians charge around $300 for initial consults. I always charge half price whenever anyone sees me doing any lectures. So for example, if you called my office now and said I saw her do a webinar, then it's $150. And right now it's every 210 days. We're looking to actually change that to once a year, so it would match up with the card. And so the initial visit actually has to be in person, and then the follow-ups can be through telemedicine. And I do know physicians all throughout the state of Florida. So if you live somewhere, or I'm sure you can recommend someone as well from from one of your offices.
Yeah, I mean, I medical marijuana treatment clinics here in Florida, and they have 25 clinics, mainly in the north and central Florida. And now their rate is approximately $200 for a visit, just to give you an idea. Okay, and they do have discounts. So if you're a veteran and you have different conditions, they will discount down from there. So, but I would say, don't be afraid of going to the medical marijuana doctor. If you don't have a condition, typically doctors don't charge you for the visit.
Right. And then also in terms of the concealed, it says I have a concealed carry card. Maybe that, like the whole concealed weapons thing, what happens with that is usually patients get their gun license or permit. I'm not sure if that's what you're asking, but they get that first, and then they get their medical marijuana card. And when they have to renew their license, then it'll ask you, do you have your medical marijuana card? But usually that takes about 10 years. So I always ask people to look when they have to renew that. I'm pretty sure that things will change. I know that our director of our commissioner of agriculture is really looking into this with the whole concealed, because it really makes no sense why you can't have a medical marijuana card and a gun permit when people drink alcohol and do things that are much more harmful. So
the first answer is you can't have a concealed weapon and a medical marijuana card. So the answer is yes. The big issue, Paul, comes in down if you want to buy another weapon, you go to the store, they have you fill out a form, and that form will ask you if you're taking, they'll ask you if you're taking marijuana. And if you answer yes, there's a chance that you probably can't get that weapon. Let's put it that way. So, that's the problem is how do you increase your, increase your collection is really the big issue with that.
Okay, so Debbie's asking about the liver and gummies. Hold on a second. Okay, so what I was saying about that was, since cannabis is fat soluble, when you take it by mouth, it has to go into your small intestine, then your stomach, into your small intestine, and then it gets emulsified. And so other fats come and break it up and make it so that it turns into something called a mixed micelle. But the point is that it's fat soluble, so it needs other parts of your digestion and other lipids to actually allow it to be transported to the aqueous layer of your small intestine. Then it goes into your bloodstream. So there's a lot of things and then it goes into your liver, your lymphatics. So there's a whole process when you take an edible or a gummy or chocolate, that it takes 60 to 90 minutes, for many people to start to work. And so when you take the nano products, the water soluble products, you don't need other fats in the body to actually get it to go into your bloodstream, and it bypasses your liver. So people who have issues with their liver, if they have hepatitis, if they have cirrhosis, if they're poor metabolizers through the liver, if they use the nano products, then they're bypassing the liver. So that's why I like the water soluble products. They're drops that go under the tongue or powder that you put into a drink. So anyone with liver issues who doesn't have a gallbladder, people who say the gummies are taking too long, the water soluble nano products are good. I know True Leaf has them, Curaleaf, Move has good products as well.
Yeah, Move is very good.
So this is funny. Have you seen patients get off gabapentin for pain by using cannabis and CBD? I had this lady yesterday who was on 2,400 milligrams of gabapentin. And she was on this from her neurologist for many, many years. And really, even if she took away one gabapentin, 300 milligrams, she actually felt withdrawal symptoms. So she was really almost like dependent on gabapentin for her pain. And she didn't have any pain anymore. So she didn't know why she was still on this medication, and she had titrated up over a long time. So the way I usually titrate off is I figure out the milligrams per day, and then I make a titration that allows you to take away, if it's gabapentin, 100 milligrams or 300 milligrams, let's say, daily for a week, and then decrease the next week by another 100 or 300 milligrams. And so I actually love cannabis for nerve pain. I think that it's more effective than gabapentin and Lyrica. It definitely has less side effects. So I like to use cannabis in this situation, but I have so many patients that have completely gotten off their gabapentin and Lyrica. And so it's one of those things like opioids that we add, and then we're able to titrate them off. A lot of times they can't just take away the gabapentin without cannabis. Do you know a doctor in Brevard County or in Orange County? Do you know one, Mark?
Yeah, I would say the MMTC clinics we have. If you go to mmtcfl.com, and we'll put that in there. They have a number of doctors in, especially in Orange County, that in Brevard, where we can actually refer doctors that are there.
So this says I can't use the vapor smoking. What's the next best thing? So if you can't do a form of inhalation, I would say the nano water solubles are great, or a tincture, or you can take regular flour and put it in a vaporizer and see if that is better. But if there's no form of inhalation or smoking, then I would say a tincture or the nano drops.
And I found the transdermal patches are very effective. They really are effective. You know, in my case, I'm trying to manage both inflammation and pain, and so I either have a CBD patch on or a THC patch. And in my case, I get the ones from Move that last 3 days, and it's great. It really helps me with it just helps me be able to form a base that I can work from to be able to regulate and really get my pain level down as well as my inflammation down.
Someone asked, what's the best way to get educated about medical marijuana? When you get your card, really, I would say listen to webinars like this, but I honestly think the best way to get educated is to slowly take cannabis, to really because everybody's different. You can learn a lot and you can read a lot, but how it affects you is going to be different than how it affects somebody else. So I really like people to get used to using ratio products so that they're able to understand how sensitive they are to THC. I think that there's websites like Project CBD that has a lot of good information. My website, Marc's website, has some great information. But honestly, getting educated about medical marijuana is really understanding how you're using it, why you're using it, how it's affecting you. We can learn a lot about the plant, and you can go on Leafly, for example, learn about all the strains and the different terpenes. But one thing is reading and another thing is taking it. So I think it's really starting low and increasing it slowly, and really not being scared to increase all the way if necessary.
We put on this webinar series. We every week we talk about a different condition. For example, next week we're talking about PTS, for example. Last week we talked about migraines. We are doing this to educate people on different subjects. I think it's important. And the main theme on all of these is really listen to your body, which is what you're really saying. Really go through and try different cannabis products and really see how it works, because every body is different. But also we'll send you some links to our websites where we have like Marijuana Med Today, where we're trying to build like a WebMD kind of thing for medical cannabis. We're trying to build up that information so that people can be able to get educated that's out there.
And then this one's, how does cannabis affect the liver? So CBD is actually broken down in our liver. THC is converted to delta 11 in the liver. So it's definitely something that goes through our liver, and it's not harmful to our liver, but it's also something that if your liver is not functioning properly, you're able to vape or smoke or use nano products to bypass that. So someone asked like a little bit more of a detailed question, and I just kind of want to respond by saying that a lot of times people are on a regimen and maybe it's not working. And sometimes it's good to really take a step back and almost wean off the regimen you've been on if it's not working, and reset your endocannabinoid system and kind of start over. So a lot of times I'll tell people that let's just take, a week to titrate off, and then take a few days off, and then restart. So there's a lot of other products maybe they haven't tried, and I think a lot of people get used to the concept that if it's not working, take a higher dose, and I don't really think that's the right answer. A lot of times we need to switch the ratio, switch the route of administration. Maybe your liver is not properly metabolizing it. Maybe there's another form that would be better for you. So I think if you've been taking something and it's just not working, one good option is to kind of take some time off and then restart a new regimen?
One prime example was right after my knee surgery. I actually work with Jewett Orthopedic. I work with Dr. Constance there, who is an orthopedic surgeon, and I was their guinea pig for post-surgical medical marijuana instead of pharma drugs. And literally when I left the hospital, I started a cannabis routine, which I had worked on with doctors beforehand. And I was able to lower my pain level down to a 1. What was fascinating was one night I was having pain, and I had this concept of pain, THC, inflammation, CBD, and I ran out of THC, and I was having some problems, and I took some additional CBD. Guess what? My pain started to go away, and it dawned on me my pain was coming from the inflammation, and the THC wasn't answering the question. And when I get the more CBD, my pain started to go away, because it wasn't for pain, it was getting rid of the inflammation that got rid of the pain. So I think that's where it's an example of where you listen to your body and try different things, and don't be afraid to use more CBD, because again, if you have pain related to inflammation, it's something that it's surprising how well it works.
And yeah, no, I'm a big fan of listening to your body. When people, and that's kind of like really, what I really want people to understand about fibromyalgia is whether or not somebody believes you, this is your body. If you actually, you're living in this body, if there's something that doesn't feel right, then it's not right. And so whether or not a doctor knows the answer, that's what I think is frustrating. People get passed around to different specialists, from neurologists to the rheumatologist, because there's no way of making a clear diagnosis, and also because they don't have the right prescription to write you to feel better, because they know that this is a condition that is very frustrating. But also, once we really learn more about endocannabinoid deficiency, if you had a deficiency with a vitamin, you would take the vitamin. If you're deficient in your endogenous cannabinoids, you have to use cannabis. And I have seen hundreds of patients with fibromyalgia go back to work, and then eventually even wean off their cannabis, because their body is starting to maintain this balance themselves. So I think if someone is telling you that you don't have something that your body is telling you do have, then you're probably seeing the wrong physician. And I also think that just because we're taught a certain thing in medical school and we have these limitations within our toolbox, physicians need to really start seeing what's really going on in the world. Plant medicine is really starting to take over, because I think a lot of conditions are turning into chronic conditions, and pharmaceuticals have obviously so many side effects, but there's so many benefits of the plant. It's just really, when it comes to education, it's really empowering the patient to use the medication. That's the way I look at it.
And I think you have a good point called the endocannabinoid, actually the entourage effect, where your body knows where you have a problem. You don't need a doctor. Your body doesn't need a doctor to tell you have a problem. In the case of my mother, she was taking cannabis for breast cancer. And what happened was she went to the doctor, the glaucoma doctor, and her glaucoma went away. And when she explained to the doctor what she was doing, he said, "Oh yeah, cannabis works very well for glaucoma." And of course, she called me up and said, "You didn't tell me that." Well, I didn't know she was going to the doctor for glaucoma. But when I did the webinars, we did webinars throughout Florida. It's like we did about 135 of them. I'd have patients that would say, I took cannabis from an arthritis, and the shoulder, my pain in my shoulder went away. And by the way, I got a good night's sleep for the first time in 20 years. It's that's that entourage effect that takes cannabis, tunes into your body, finds where the problem is, and addresses it. And you don't need a doctor to do that.
And I also think that just getting good sleep is really important. A lot of times people are coming for, Parkinson's or pain or whatever it is, but asking people, are you sleeping well, and trying to get restful sleep, that will also decrease a lot of the pain during the day. It's just having your body restore and heal itself while you're sleeping. And really, honestly, it bothers me when people say that the physician doesn't believe in fibromyalgia, because it's not about believing in a condition. It's really listening to the patient, and the patient telling you something is not right with my body. Maybe the physician can, say, I'm not sure exactly what it is, but, then there should be people who are competent enough to refer out and not really put people on a lot of medications. And that's really what I see with the fibromyalgia population. It's very frustrating, because by the time I get them, they're in a worse position than before they would have started on the medications.
You make a good point. Cannabis is usually the last resort.
Right.
So we see people that come into, and again, I'm not a doctor. what I do is I connect dots. You know, I'm a technology guy, and I got in this business to connect the dots between doctors and patients and information and that type of thing. But it's interesting how most of the people I run into, this is the last resort. The doctor said, I can't help you, or they bounce around between doctors. And yet they land on a good cannabis doctor, and all of a sudden they get their life back. I mean, literally. I mean, there's a lady that I met in the villages that had rheumatoid arthritis to the point where she couldn't hold a remote control. She couldn't hold a glass. She couldn't hold a knife and a fork. So she became a recluse because she was just worried about that. We put her on, when she got, I shouldn't say we, the MMTC folks put her on medical cannabis. Literally within 6 weeks, she was at a point where she could hold a glass. She could hold a fork. You know, she ended up now. I mean, it's kind of, we stay in touch with her. She plays cards with her friends. She's out playing golf. I mean, she's got her life back. And her comment was, "Why did it take me 77 years to figure this out?"
Right. No, and also it's also giving someone hope. You know, that plays into the concept of neuroplasticity. If you tell someone, I don't have a good treatment for the symptom you have, well, that really makes someone feel very frustrated and hopeless. So I think just, you know, educating people that cannabis can be effective for some of the conditions that we don't have good treatments for will allow people to think in a more positive way, that they may, you know, there may be something out there for them. And cannabis is really very effective for fibromyalgia. It's just a matter of being comfortable trying it, and really financial issues are the biggest problem I see, you know, just paying for the products.
Totally agree. If the state could go to once a year visits rather than twice, I think that'd be a great move. I mean, I've always wondered why, if I have a condition like my neck condition, it's not going to go away in 6 months. I mean,
Right.
I should look at it again. Trust me, I got it. And if there's a way they can go away, you all let me know. I'm down on that one. But why I have to have a doctor to tell me it's still there, or tell the state it's still there, I don't understand.
I
I
agree.
mean, we're not playing. Trust me, I'm not playing any games here. I think it's my vote is, if you need somebody to give that recommendation, here's one right here. But I think that's important. I think one of the you mentioned the mental state that puts you in. One of the things is that I found that when people do take cannabis, not only does it treat whatever they're treating, but I found people become, I wouldn't say happier, but their mood changes to a point where they're more positive. You know, whether they're half empty or glass is half empty or glass full, it kind of goes to a middle point if your glass half empty, and your life is a little bit better. Let's put it that way.
Right. And even just getting sleep, you know, you have more energy during the day, you're able to focus, you're able to be clear, you're able to exercise, make better decisions on your nutrition. So yeah, there's so many benefits. It's really just personalizing it.
Yeah, make a big difference. Well, I think we nailed all the questions, I think.
Okay.
Thank
you for having me.
You'd like to make?
No, I hope that it gave some people hope, you know, that really, if they are listening to their body and they know that they're not feeling well, that cannabis may be an option, and that as long as they're doing it with an educated physician and someone who actually respects the plan and respects the patient, then they'll probably be very successful.
Yeah. Well, Dr. Weiner, Michelle, thank you very much. It was very insightful. It was a great job, and I do think that it really helps to really have a positive, just say, outlook on things like this. I'm going to shamelessly throw a plug into the fact that we're going to do another webinar next week for PTS. So if you have that particular condition, please let us know. The week after that is glaucoma, just to give you an idea. So we are definitely, and then the week after that, we're doing treating cannabis as an exit drug. So there are different webinars coming up, and I show that. My Botanical Wellness can help you with some CBD products. I think you have some products as well. So we'll get you all the information about how to access those products. Please go see Michelle if you're in her local area, obviously. I think you've not only got a great reputation, but you've helped a lot of people. I think one of the reason we do these webinars is real simple. If one person can get their life back from this webinar, then we've accomplished what we wanted to accomplish. Obviously, we wanted to do more than that, get more than that. But if one person can just listen to it, start using it, and all of a sudden get their life back, it makes a big difference. My goal literally is on a daily basis to help one person get their life back. And fortunately, because of the websites and the things we do, we've been able to accomplish that. And we'd like to be able to accomplish that for you. So I'd like to thank everybody for tuning into the webinars. Michelle, thank you for what's here. And I hope everybody is safe. And again, thank you. And we'll be in touch. You'll be getting a follow-up email that'll have the video. It'll have a copy of the presentation. It'll have notes. It'll have all the links. And hopefully we'll try to get that out as soon as we can. So thank you very much.
Thank you.
Thank you.
Bye-bye.
Bye now.